On the road to reopening New York, major changes are happening. The state's COVID-19 state of emergency will end today.
Now, this means many of the executive powers Governor Cuomo issued will be lifted. CBS News' John Diaz live on the west side of the Javits Center with more this morning. Hi, John.
Good morning, both of you. Yeah, well, New York State had first initially reported about 75 cases nearly 15 months ago when Governor Andrew Cuomo first issued the state of emergency. The state would then go on to confirm more than 2 million cases. And today, now, this state of emergency has been lifted. This morning, New York State is turning the page on COVID-19.
Now we're starting to write a new chapter. And the new chapter that we're writing is the post-COVID emergency period.
Federal CDC guidelines will still remain in effect, so non-vaccinated people will have to continue to wear masks indoors, such as on public transit. But New York State has officially ended its state of emergency, put in place in March of last year. Also, all New York City residents 12 and older can now schedule in-home vaccinations. No requirements needed. And as of Friday, it's last call for alcohol to go. That means New Yorkers will no longer be able to order takeout or delivery cocktails from bars and restaurants.
Get out of the house. Go experience New York.
While most COVID restrictions were already lifted statewide, the end of the state of emergency means the end of Cuomo's remaining executive powers, which gave him the authority to make decisions about business closures and COVID safety protocols. While Cuomo says he will not renew the emergency, he is still urging caution.
It's not that we believe COVID is gone. We still have to vaccinate people, especially young people.
This all comes as new variants of the coronavirus are spreading. Health experts say the Delta variant, for one, spreads more quickly than the original virus.
It's about 20.6% in the United States and doubles about every 2 weeks.
Worst yet, data from the UK shows that Delta makes you more seriously ill. That combination of greater transmissibility and severity of disease has led to the new variant accounting for nearly half of all COVID-19 cases across 10 states.
It will be the dominant strain among those areas, those regions of the country where the vaccination rate is lower than we would like.
Now, back here in New York, we're told that local governments as well as businesses can still make up their own safety guidelines when it comes to COVID-19, and that does include mask rules. We're live this morning from Manhattan's West Side. John Diaz, CBS 2 News.